When someone comes to us for help, we really go looking for the reason of why they've sought us out for help. In this particular case, a lady had come to see us because she was suffering with back pain and pain in her left leg. This is a condition we classically call sciatica. Usually it presents with back pain and leg pain at the same time, but it's very possible that a person has sciatica and only experiences leg pain with no symptoms of back issues at all. The first step that we take when people come to us is to take a full medical history. After taking a history of this lady, it was clear that a car accident had caused her issues. And actually, it was a much worse car accident than the picture presents here. Because in her case, she'd actually fractured a vertebra in her neck and in her low back as well. Now, when someone's had an injury that's caused a fracture in any part of the spine, that's a clear indicator for me that I need to take an X-ray to have a closer look inside and see where the problems are. Fractured vertebrae are certainly not the only reason you'd want to take an X-ray, but they are a definite indicator that you must take an X-ray. In addition to the pain in the low back and in the leg as well, she was also suffering with numbness on the outside of her left foot, and she was suffering with bowel issues. Bowel issues are actually quite common when people have injured their low back. So I was not surprised to see this collection of symptoms all in one place at the same time. Now, our first step with any kind of evaluation following taking the medical history is to do a surface anatomical structural analysis. You can also call that a postural analysis. And in this case with this lady, and we're just looking at her postural analysis from the front, she looks fairly normal. We do a postural analysis from the side as well, and she looked fairly normal there too. But I knew from the collection of symptoms that she was suffering with that things were not normal on the inside. So we had strong indicators from our history that we needed to take X-rays and look inside. But from the structural analysis on the outside, things looked pretty normal and she looked to be pretty healthy. Before we took the X-rays though, we conducted some thermographs and electromyographs. These are very accurate ways for us to evaluate what's happening on the inside of the body without any kind of invasive procedure whatsoever. And the results of these correlate very strongly with nerve function, which is why we loosely term them as nerve scans. What we could see from these scans is that there was a definite injury on the left-hand side of the low back, which is where she was reporting the problem, and there were issues in the neck as well. Everything else was functioning pretty normally. The interesting thing about her neck is that she wasn't reporting any symptoms there, but her medical history had revealed that she'd sustained a fracture in the neck after having a car accident. So I wasn't at all surprised to see that there were abnormal readings in the neck as well. Very important not to overlook the neck, because sometimes low back issues and issues with the legs can actually be generated by injuries that have been sustained in the neck as well. So they must always be considered as part of the problem. Now, in this particular case, the medical history indicated that we needed to take a series of at least 4 X-rays, which is what we did. Just by looking at these raw X-rays, I could see that there were some serious problems in the low back and the neck as well. And this was before any kind of computer analysis had been applied to the X-rays. Now, although the unanalyzed X-rays really did show that there were some severe problems inside this person, the analyzed X-rays allow us to quantify these mathematically. But more importantly than that, the computer analysis helps us to be more precise when we work with the spine in order to remodel those injuries and actually get rid of a majority of the problems that a person might be suffering with. The neck X-ray clearly showed that she had sustained a fracture of C6. More importantly than that though, she'd lost the normal curve in her neck. Her neck in this case was actually bending in the wrong way, and we would call that a cervical kyphosis. If it was bending the right way, we'd call it a cervical lordosis. And this is associated with causing very serious neurological changes. In animal models, for example, research scientists have been able to cause demyelination of the spinal cord simply by surgically engineering a kyphosis in what should be a lordotic neck. And this can have really severe consequences for someone suffering with it. And although it is very serious, it's also very correctable. In other words, If someone has lost their normal lordotic neck shape, we can restore that in most cases. When I looked at the analysis of the lumbar x-rays, it was very clear that this lady had sustained an even bigger fracture of her L4 vertebrae than she had in the neck, the C6 vertebra. Her rib cage was also translated backwards, or in other words moved backwards from the normal position, which means her lumbar spine, her low back, was not positioned correctly. This increases the pressure that a person experiences in their low back, and it can certainly be a cause of low back discomfort and pain and sciatic symptoms. And when I looked at the analysis of her low back from the front, it was very clear that there was a large translation of her low back to the left. This is most likely because in the car accident she was involved in, another driver had struck the side of her car at 60 miles an hour. And this is the reason in many cases for people to have such a large buckling injury of a part of their spine. So to summarize her whole case, her x-rays revealed that she'd sustained significant mechanical injuries to both the neck and the low back. And her nerve scans revealed there were significant abnormalities in the function of her nerve system as well. And this is important because in pain medicine, it's the nerves that actually conduct the pain that a person is suffering with. The good news though in this case is that these kinds of injuries respond really well to care. It is possible to restore the normal curve in the neck. It is possible to restore the normal position of the rib cage and the normal position of the lower back. And it's also possible to straighten out a spine that's deviated one way or another after a significant buckle injury. So this person was able to respond really well to our therapy.